Have you or someone you know ever experienced an unexpected seizure? Maybe it's happened out of nowhere, leaving everyone feeling confused, frightened, and unsure about what comes next. Well, you're not alone. In fact, about 10% of adults will have a seizure in their lifetime. But here's the tricky part. Not everyone who experiences one seizure will have another, and many don't know what caused it in the first place. Is it epilepsy, or something else? If this sounds familiar, stick around because we're going to break down everything you need to know about seizure disorders in a way that's easy to understand. Whether you're worried about yourself, a friend, or a family member, you're in the right place. What are seizures? The brain's electrical misfires. First off, let's talk about what a seizure actually is. Think of your brain like a big, complex electrical system, constantly sending signals to keep everything running smoothly. But sometimes, just like a power surge in your house, the brain can have its own electrical overload. That's when a seizure happens, an abnormal burst of electrical activity that throws the brain off balance. It can cause anything from a small twitch in the body to a complete loss of consciousness. The effects depend on where in the brain this surge occurs. The major types of seizure disorders: epileptic, psychogenic, and non-epileptic. Now that we've covered what seizures are, let's talk about the three major types of seizure disorders. 1. Epilepsy, ESD. Epilepsy is probably the most well-known seizure disorder. But what exactly makes epilepsy different? People with epilepsy have recurring seizures 2 or more that happen more than 24 hours apart. And these aren't triggered by temporary conditions, like stress or fever. Think of epilepsy as a chronic condition where the brain is prone to these sudden electrical surges without any immediate outside cause. 2. Psychogenic non-epileptic seizures, PINS. Ever heard of pseudo-seizures? These look and feel just like epileptic seizures, but there's a twist: they aren't caused by electrical problems in the brain. Instead, they're linked to psychological factors, like intense stress or trauma. Imagine your brain is so overwhelmed by emotional pressure that it reacts physically. These seizures are real and can be just as disruptive, even though they don't show up on brain scans the same way epileptic seizures do. 3. Non-epileptic seizures. These seizures are provoked by temporary conditions, like drug withdrawal, infections, or even a high fever in children. Picture this: you're really sick, and your body's under so much strain that your brain goes into overload mode, causing a seizure. Once the underlying issue is treated, these seizures often stop. What can cause seizures? The usual suspects. Seizures don't just happen out of thin air. There are many things that can trigger one. Here's a breakdown of the most common causes by age. Children under 2 years old, fever, birth injuries, and genetic conditions. 2 to 14 years old, infections, tumors, or lingering effects from a fever. Adults, head injuries, tumors, strokes, and infections. Older adults, stroke, tumors, or neurodegenerative diseases like Alzheimer's. But beyond that, seizures can be triggered by things like lack of sleep, extreme stress, drug use or withdrawal, flashing lights, repetitive sounds, or even certain music and video games. Think of the brain like a circuit breaker. When it's pushed too far, whether by stress, illness, or lack of sleep, it can trip, leading to a seizure. How are seizures classified? In 2017, experts developed a new system to better understand seizures. The idea is simple: where does the seizure start in the brain? Generalized onset seizures. These start in both sides of the brain at once, and most people lose consciousness. Some people might experience muscle twitching or stiffening, while others just zone out for a few seconds. Tonic-clonic seizures, formerly known as grand mal. You might recognize these as the type where a person falls, their muscles stiffen, and they may jerk uncontrollably. Absence seizures, formerly petit mal. These are less dramatic but still concerning. The person may simply stare blankly or blink rapidly for a few seconds. Focal onset seizures. These start in one specific part of the brain. They might only cause symptoms on one side of the body but can spread to both sides. There are two types. Focal aware seizures. The person stays conscious but may feel unusual sensations or twitch in one part of their body. Focal impaired awareness seizures. These cause confusion or loss of awareness, and the person may act in ways they can't remember afterward. Unknown onset seizures. Sometimes, doctors don't know where the seizure starts, especially if the person wasn't observed or tested right away. As more information comes to light, these may be reclassified. What do seizures feel like? Common symptoms. Seizures don't look the same for everyone. Some people have major convulsions, while others just experience strange sensations. Here are some common signs to watch for. Muscle jerking, twitching, or stiffening. Loss of consciousness. Rapid blinking or staring into space. Confusion or disorientation. Strange smells or tastes. A feeling of zoning out or having out-of-body experiences. Tingling or numbness. Involuntary crying out. Loss of control of the bladder or bowels. After the seizure ends, a person might feel exhausted, confused, or even have muscle pain. But here's something important. Most seizures only last a few seconds to a couple of minutes, and while they can be scary, they're often not dangerous if managed properly. How are seizure disorders treated? The good news? Seizure disorders are treatable. And with the right approach, many people live normal, healthy lives. Here's what treatment options might look like. Medication. Anti-seizure drugs are the most common treatment. The goal is to control seizures so they become less frequent or even stop altogether. Surgery. For people whose seizures are caused by something like a tumor or abnormal brain tissue, surgery might help. Medical devices. Some devices, like a pacemaker for the brain, can help control seizures before they start by stimulating certain nerves. Lifestyle changes, stress management, plenty of sleep, and avoiding seizure triggers, like flashing lights or alcohol, can go a long way in keeping things under control. The World Health Organization says that with proper treatment, up to 70% of people with epilepsy could stop experiencing seizures altogether. That's a pretty hopeful statistic, right? When to see a doctor, and when to call 911. If you or someone you know experiences a seizure, it's always a good idea to see a doctor, especially if it's the first time. But when should you call for emergency help? The seizure lasts more than 5 minutes. Another seizure starts right after the first. The person has never had a seizure before. They have trouble breathing or walking afterward. The seizure happens in water. They have a medical condition like diabetes or heart disease, or they're pregnant. Don't wait. It's better to be safe than sorry. Conclusion: living with seizure disorders. Seizures are scary, no doubt. But with knowledge comes power. Understanding the causes, types, and treatments for seizure disorders can help you feel more in control and less afraid. If you or a loved one is dealing with seizures, take heart. There are many ways to manage and even prevent them. Always work closely with your healthcare provider to find the best plan for you. Remember, just like an electrical surge in your house, a seizure can seem sudden and overwhelming, but with the right support, you can reset, rebuild, and move forward with confidence.